The broadcast is now starting. All attendees are in listen-only mode.
All right,
Good
all ready.
Okay. Good evening. We're going to be talking about a new book that has come out recently, Psychogenic Non-epileptic Seizures Guide. This is a book that was published earlier this year, and I'm the author. And we're going to be talking today about how the idea of the book came about, what its uses are, and what's in the future. Hopefully this will also open a dialogue. I already speak to a number of people who have read the book and have heard comments back, and I would like to continue hearing from as many readers as possible. This is the cover of the book. It has a meaning behind it. This book is meant to be a guide. It's meant to be like a lighthouse that is providing some direction towards a safer harbor. And the question you may start asking is, who am I? I am, to begin with, a clinical psychologist. I earned my PhD from CUNY, City University of New York, over a decade ago. I completed a postdoctoral fellowship in neuropsychology. I've been a practicing psychologist in New York for 11 years. I am the director of clinical neuropsychology, was the director of clinical neuropsychology at the Northeast Regional Epilepsy Group until earlier in April of this year. The clinical neuropsychology program now has 2 co-directors, and I am currently the director of the Psychogenic Non-epileptic Seizures program. I'm also the co-director of Epilepsy Lifelinks and the executive director of Epilepsy Free Foundation. I have been working with PNES now for approximately 11 years, and have over these years collected quite a bit of experience, as well as publishing and doing research and so forth, and seeing a very large number of patients who carry this diagnosis. Just before we even get started talking about the book, just want to go over what is the definition of PNES. Psychogenic non-epileptic seizures are seizures that very much resemble epileptic seizures but do not show abnormalities on EEG. They are believed to stem from emotional distress and from something called emotional dysregulation. So basically difficulty in regulating certain intense emotions. And they do require mental health treatments rather than epilepsy treatments. It's very important to make the correct diagnosis in order to be able to refer the patient to the proper type of treatment. Now, why this book came to be? Basically, bottom line, it was necessary. It was necessary to bridge a lack of information that existed online, in print, or nearly anywhere for patients to read. This is a constant concern for us and for patients newly diagnosed and those who have been carrying a diagnosis of PNES for some time, that there was almost nowhere to read reliable information about the disorder and reliable information to be able to share with others. The book also came to be to put PNES on the map and give it the recognition that it deserves. It is a serious condition and requires being recognized by health professionals and so forth, and a good way to do that is by having a book. It is also written to provide a guide for patients and loved ones and caretakers on what can be keeping PNES alive and some of the pathways that might be followed towards a healthier existence. And it is also seen by me as a springboard to advance PNES research and education. And I'll talk a little bit more about how I see that happening. It was born out of frustration. Many patients only receive a diagnosis of PNES, So they basically receive a name, and they are then discharged with little or no information. I picture that this book might be a source of information that could be provided to patients upon diagnosis so that they can start to read and understand the diagnosis that they've been given, and also start to look at ways in which help might be achieved. It was also written because many mental health professionals do not know PNES and often feel that they can't treat it. So the book is mainly meant as well as a educational tool for health professionals who may be first encountering PNES or who may feel that they simply need to have more information before they can come on board to treat the patient. I have heard from many patients that they call a number of different mental health professionals only to be told that this does not seem to be something that the professional can work with, or that this seems like more of a neurological disorder and that it's beyond their scope of practice. The book is meant to show that this is really a psychological condition, and it can and should be treated by psychologists, psychiatrists, social workers, or other therapists. It is also written for many loved ones or caretakers or emergency personnel and the general public who don't understand the diagnosis and may even doubt it, and sometimes treat the patient in a way that is not helpful. And it was also born out of frustration because I was receiving a steady flow or flood of inquiries via email and Facebook. And I found myself often giving the same answers, and eventually thought it would be much more efficient if I were to put this all in one book, and that it would also be available to those people who had questions. I love getting questions, and I love getting emails and inquiries and so forth, but it just seemed that this would be a much more efficient way of getting information out to the public. So how this book came to be, I had been waiting for many years for a book of this kind to come out, and I was sure that at some point it would come out. And I found that after over a decade, no one had yet written something about this. So I decided that I would need to sit down and write a book for patients. I've been waiting for years for there to be educational programs for patients and for health professionals and mental health professionals, and also this was not happening at the speed that is needed. I'd also been waiting for a long time for recognition of the severity and of the importance of this condition in psychology and psychiatry associations. Dr. Benedict from Florida has written about this extensively, about how PNES is not recognized in the major websites of the Psychiatry Association and the Psychology Association and so forth, and there really seems to be a lack of information and even acknowledgement of this condition. And I also had been waiting for many years for greater fund allocation to research of PNES. Research requires funding, and if a condition is not shown to be serious and to have major impacts on health and on costs and so forth, then it's hard to get funding. So there was a real need for funding for research, and this was coming very slowly. So the book came to be in a gradual way. Initially, the need for information on PNES, we tried to fulfill this need by writing up a brochure on PNES, and we have it disseminated in all of our offices. But this seemed only to be reaching, obviously, our patients who came to our waiting rooms. We then started educational programs through group settings in our offices. We moved on to creating a website. So we acquired non-epileptic-seizures.com and have an information section there that has frequently asked questions about PNES. Then moved on to creating a Facebook page where news stories about PNES or recent issues that have to do with PNES or any associated concerns were posted. I then went on to start a blog in which about once a month I would write about a certain topic, either concerns about the lack of information on PNES or healthcare barriers, or research that we were working on and some of the results that had come out and so forth. We then went on to start using webinars, which is what you're listening in on right now. And back last year, I presented a webinar that was basically an introduction to PNES. So each one of these exercises in trying to put together information and get information out to the public were leading up, without my even knowing, to eventually realizing that all of this needed to be put into one source, and that is how the idea of the book came about. So what went into it, writing? It took about 18 months. Initially, it seemed like it would be a lot quicker, but of course, writing a book is a big project. I did have an editor who worked with me, and we bounced chapters and rewrites back and forth. I needed to find an illustrator because I had a very unique cover in mind, and I had certain images in mind that I wanted from for the different chapters. And I really have to thank Dr. Marcella Lankman, who's the director of our program, for proofreading a number of final drafts and really providing some useful comments and edits. So the purpose of the PNES book, of PNES A Guide, is primarily education. This is education for patients who have received a diagnosis of PNES. In particular, I see it as being very useful for patients who are receiving a first-time diagnosis. And often there is a lot of confusion and not knowing what this means. And the book is meant to really introduce and to educate on what this diagnosis is. It is also meant to educate loved ones and caretakers, and by caretakers I also mean health professionals who may be encountering PNES for the first time or who would want to read more about the topic. And let's talk about what the book does. It explains, to begin with, what PNES is, what are the signs, what are the origins, what might lead a physician to think that PNES needs to be ruled out, how it is diagnosed, and then it goes through what types of treatments and mental health professionals there are and how to go about finding them. There are a number of mental health professionals that exist. They each have their own specialization. They each have their own uses. And so the book goes through explaining what is the difference between a psychologist, a psychiatrist, a social worker, what are some of the professional locator sites where you might go to find one of these professionals, and it briefly goes over the different kinds of treatments that, that exist. And in psychotherapy there are a multitude of treatments, and so the book is really meant to explain what is the difference between, for example, psychoanalytic or psychodynamic treatment versus cognitive behavioral treatment that you may hear about, family treatment, and so forth, so that you really are as educated a consumer as possible when you start looking for therapy and for any other type of treatment that you may need. The book also goes through a very important topic for PNES, which is trauma and PTSD, and goes over how these can be important factors in PNES. It also explains what the role of depression is, anxiety, and anger. So what these emotional factors, what sort of roles they play in PNES, as well as going over and introducing the reader to some ways in which you might address depression, anxiety, and anger. It is clear throughout the book that this is not meant to be a self-help book that should be used without the help of a professional, but rather this is a complement to working in a professional setting. And a number of the exercises included in the book are meant to introduce you to what types of work you might be doing in therapy. The other things that the book does is to discuss the pros and cons of complementary and alternative treatment, going over a number of supplements and other natural remedies that many of my patients have either reported taking or have reported that they were thinking of taking. And it goes over risks as well as benefits of these different types of treatments. We also talk about in this book about different types of exercises and physical techniques that might be useful for a complement in PNES treatment. The book also discusses wellness and health, the importance of nutrition, physical exercise, and sleep, always considering safety when you are engaging in physical exercise, considering that PNES is in the background. It also discusses how to maintain a good quality of life while living with PNES, paying special attention to safety issues, paying attention to certain relationship issues that tend to come up when you're dealing with PNES. And finally, the book goes to discuss where we all need to go from here. And there's really a series of things that, very important things that still need to be done, including research, including advancing public knowledge, and so forth. And the final chapter is basically going over where we are heading and where we need to head from here on out. It's also important to talk about what the book does not do. So important to realize that this book is written for adults who have PNES. Children are very different, and this book is basically written for an adult reader, and it discusses that which I am specialized in, which is PNES in adults. Children present a very different picture, and a book on PNES in children has still not come out, and I would hope that it would come out very soon. It is also not meant to replace professional treatment or to be a standalone self-help book. It is written as a complement to professional treatment. PNES is a very serious disorder and typically requires professional treatment to achieve health. And it is not meant to be a training manual for professionals either. It's meant to be an introduction, perhaps to someone who is a professional and who has no information on PNES at the time that they pick up the book. But there are a number of other professional books on PNES that would be recommended for a professional who is moving into a specialization of treating PNES. Question that I think is very important is what's happening with the royalties of this book. And I'm really happy to be able to say that all the royalties are being donated to a foundation that has agreed to support PNES. and that is the Epilepsy Free Foundation, which I very recently became the executive director of. And I'm happy to be in that position because it does ensure that I am well informed of how the funding is being used, and I really wanted to know that the funding was being allocated to PNES. So this is a foundation that does initially started working with epilepsy and has now opened its objectives to also working with seizure disorders including PNES. Now, there are two main objectives that I have, and this is part of my agreeing to work with the Epilepsy Free Foundation. I did not want to give my royalties over to a foundation that could not assure me that they would be using this money to help patients with PNES. So there are two main objectives that we have agreed upon, and one is that the royalties will be used to help patients help themselves, and one of the best ways that I could think of helping patients is to have a continuing education fund. So someone with PNES can apply to continue to receive a scholarship to continue their education. It can be either a college education or a trade school or something that shows that the patient is going after an educational objective that requires some funding. And the second objective is to promote and fund education for professionals. This is very, very much needed at this point in the U.S. and elsewhere. Health and mental health professionals could benefit tremendously from more education on PNES. And it seems that we are going to need to do this ourselves. We need funds for this, and so then the royalties will be used to be able to fund educational programs for professionals. This is still in the works, but this is very much something that I want for us to get done. Now, how is the book doing? It was published January 25th of this year, 2014. Sales are moving briskly, which is really fantastic. So there have been nearly 300 books sold. They've been sold in many different countries: USA, Great Britain, Australia, other European countries, Japan, South Africa, Canada. So there's really been a dissemination of information, at least based on where and how many of these books have been purchased. There's a potential translation and publication in another country that's being considered, and some sales are even being made in bulk, which suggests to me, I don't know, but it would suggest that perhaps there are epilepsy centers or epilepsy programs and neurology centers that may be buying a number of books that they may be then providing to their patients. That would be fantastic if that were the case. What else is happening with the book? It is currently being reviewed for the Epilepsy and Behavior Journal, which is a professional journal. There is a question of whether the Epilepsy Currents Journal will create a book review section, and this book might be reviewed in that journal, which is another professional journal. And there may be yet another journal that may choose to review it. I'm not going to say which one or anything because it's still very much in the works. It's very important for the book to be reviewed in professional journals because this is a good way to reach health professionals and to inform them that this exists. We are planning a conference on PNES that is going to be for patients as well as for nurses. This will be September 20th of this year in Mahwah, New Jersey. It's an all-day conference on PNES, and there's a program, a full program that's available on this link. And I really need to mention that there have been some incredible supporters of this book, which have included the Northeast Regional Epilepsy Group, the Diagnostic and Treatment Team. The Northeast Regional Epilepsy Group has supported neuropsychology and has been supporting our research initiatives in PNES. And they have very generously purchased a number of books. And each patient who is given a diagnosis of PNES at one of our hospitals, and we have 4 level 4 epilepsy centers, as well as a number of other hospital units. Each patient who receives a diagnosis on one of our units is also receiving a book so that they can start to read about this. This is really a fantastic initiative. I'm very pleased to see that this is happening, because this is one of the reasons that I wrote the book, thinking about patients who are receiving the diagnosis and being able to provide something that that educates and that helps get on the right path. The American Epilepsy Society, AES, has really also been tremendously supportive. The administrative staff have been fantastic in spreading the word about the PNES scholarship, and the PNES task force has also been incredibly supportive. Dr. Rochelle Kaplan read the book, as well as Dr. Sigita Pliopoulos and some of the other AES task force members. Dr. Kaplan has recommended this as reading material to other professionals, and continues to support the dissemination of this because she feels that this is a useful resource for patients. There have been a number of epilepsy specialists, MDs, nurses, psychiatrists, psychologists, many who are members of AES, the American Epilepsy Society, who have been extremely positive and have been exchanging emails with me about the book. Future plans, as I've mentioned before, I would absolutely love to supply copies of the book to every large epilepsy program in the U.S. and perhaps elsewhere. I have heard from Europe and so forth from patients who are also asking for more information to be provided to their hospital centers and so forth. And the hope would be that these programs could provide the book to patients upon diagnosis. Other future plans are to continue working very closely with the AES PNES task force to promote education about PNES. And I really need to hear from you. What other unmet needs are there that we might cover, that we might need to look at? My ideas at this point have been continuing education funds and educating professionals. But what other needs are there that we might be able to use these funds for? So I thank you very much for listening to this. If you do want to communicate with me, you can do so either through the Facebook page through messaging, or you can send me an email to lmyers@epilepsygroup.com. And I thank you. Good night.